Hey there, ready to dive into the future of healthcare? We're talking high-tech, cutting-edge stuff, specifically how we can supercharge healthcare workers' IT skills for the digital revolution that's already happening in medicine.
It's not just about keeping up. It's about giving healthcare professionals the tools to truly leverage technology to improve patient care.
It's about meeting those futuristic sci-fi medical advancements head-on. And lucky for us, we've got an incredible study that dives deep into boosting IT skills for healthcare workers across the EU. Think of it as a roadmap for a more tech-savvy healthcare system.
And what's fascinating about this study is that it wasn't just some theoretical exercise. They brought in the big guns, 46 experts from across the healthcare spectrum, doctors, nurses, tech specialists, you name it all, laser focused on finding the most impactful ways to upgrade these essential IT skills.
Okay, so 46 brilliant minds walk into a room. It sounds like the start of a nerdy healthcare joke. What did they come up with?
They actually used a really cool method to sift through all the possibilities and prioritize recommendations. It's called the CHNRI method. Basically, it helps cut through the noise and figure out what moves the needle in a big way. And you know what they landed on as absolutely mission critical?
Let me guess. More coffee breaks.
Close, but not quite. Training, training. That was the overwhelming message.
Makes sense, right? You need to know how to use the tools. But I'm guessing it's more nuanced than just learn how to turn on a computer. We're talking about preparing for a future where AI diagnoses your cough and robots assist in surgery.
You hit the nail on the head. The study emphasizes that it's not enough to just tack on a few IT classes as an afterthought. We need to be weaving health IT into the very fabric of healthcare education from day one in undergraduate courses all the way to specialized postgraduate programs.
So it's less like adding sprinkles to a finished cake and more like baking those sprinkles right into the batter.
Yes. Integrated, foundational, and ever-evolving, and the quality of that training. That matters too. The study found that it's crucial to have experienced educators, those on the cutting edge of health IT leading the charge. We're talking about educators who don't just talk the talk, but walk the walk, guiding the next generation of tech-savvy healthcare professionals.
It makes you wonder, what would those classes even look like? Are we talking Robot Anatomy 101?
Yeah.
Decoding the Matrix?
Okay, maybe not that exciting, but the study does pinpoint a crucial aspect. Training needs to be laser-focused on how these skills directly translate to better patient care. So think telehealth connecting with patients remotely navigating electronic health records like a pro, and even using AI to make more informed decisions.
So it's not just about knowing how to code or troubleshoot software. It's about leveraging tech to deliver better, more efficient care.
Precisely. And another key takeaway: training can't be one size fits all. A doctor needs a different set of IT skills than a nurse or a pharmacist, right?
That's a no-brainer.
Just-
You wouldn't want your cardiologist performing surgery with their knowledge of spreadsheets.
Exactly. The study emphasized the need for role-specific training programs tailored to the unique needs of each healthcare profession. It's about equipping everyone with the precise digital tools they need to excel in their roles.
So training needs to be deeply integrated, laser-focused, and customized. But let's be real, even with the best training programs, there are always bumps in the road. What did these experts flag as potential challenges? Because let's face it, healthcare systems aren't exactly known for their agility when it comes to change.
You're telling me. It's
Yeah.
like trying to turn a giant cruise ship, right? But one challenge that really jumped out at me was the experts' hesitation around online training tools.
No, that's a head-scratcher.
Yeah.
In a world where we can order groceries, manage our finances, and even have virtual doctor's appointments online, you'd think online learning would be a no-brainer for health IT.
You'd think so, wouldn't you? But the study highlighted a preference for in-person, hands-on learning experiences. It seems like they were concerned about the effectiveness of online training, at least back then.
To be fair, this study was done in 2017. Remember those clunky webinars with terrible audio and pixelated slides? A lot has changed since then.
That's a good point. Today, we have virtual reality simulations, interactive platforms, and all sorts of engaging online tools that could address those concerns. But their point still stands. It's not just about the format, it's about ensuring the training is engaging, interactive, and prepares healthcare workers to actually apply what they've learned in their day-to-day work.
It's like the difference between watching a cooking show and actually trying out the recipe. One teaches you the steps, the other gets you comfortable in the kitchen.
Exactly. And speaking of getting things done, the experts also flagged the who behind the how. We're talking funding and governance.
Ah, yes, the classic hurdles of resources and who's calling the shots.
Right. It's one thing to say training is crucial, everyone needs it, but it's another to actually carve out the budget for these programs to secure buy-in from institutions and to establish a clear roadmap for implementation.
And let's be honest, healthcare systems aren't exactly swimming in extra cash or known for their swift decision-making.
Exactly. The study found a lot of concern about securing adequate funding for these training programs and establishing clear lines of responsibility for overseeing e-health initiatives. Without those crucial pieces in place, even the most brilliantly designed training programs could easily fall flat.
So true. It's like having a state-of-the-art spaceship, but no fuel or a clear flight plan.
A recipe for disaster. But when we combine top-notch training with robust funding and clear governance, that's when the magic truly happens.
It's about setting those healthcare heroes up for success, not just handing them a fancy new gadget and hoping for the best.
Exactly. And this is where things get really interesting for our listeners, because this isn't just a theoretical discussion, it's a call to action.
A call to action for a more tech-savvy, patient-centered future of healthcare.
I like the
With
sounds.
that. But what does that actually look like for our listeners, especially those already working in healthcare or studying to enter the field?
Well, for those already on the front lines of healthcare, consider this your permission slip to become a champion for change. Talk to your colleagues, your supervisors, even that grumpy doctor who still uses a pager about why prioritizing health IT training isn't just a nice to have, it's a must have.
And A, it never hurts to come to the table armed with some serious research.
Yeah.
This study with its 46 experts and fancy CHNRI method is like the ultimate mic drop.
Exactly. Show them the data, share the success stories, make it impossible to ignore the need for change. Now, for those still in school mapping out their career paths, this is your chance to be discerning. When you're interviewing for jobs, don't be afraid to grill potential employers about their commitment to eHealth.
Ooh, I love a good interview role reversal.
Yeah.
What kind of training opportunities do you offer? How do you involve your staff in shaping tech decisions? Do you even have Wi-Fi that works?
Seriously, because honestly, if a healthcare organization isn't prioritizing these things in today's world, that's a red flag. You
Yeah.
deserve to work somewhere that values technology, empowers its staff, and embraces innovation.
It's like choosing between a sleek electric car and horse-drawn carriage. One is clearly taking you into the future of healthcare.
And remember, this isn't just about keeping up with the latest gadgets. It's about delivering the best possible care for patients. And increasingly, that requires embracing the power of technology.
Absolutely, and that brings us to the heart of this whole conversation. This deep dive has really hammered home that this isn't just about the tech itself, it's about the people.
It's about empowering healthcare workers to be at the forefront of this change, to use technology as a tool that enhances your skills and ultimately improves patient outcomes.
And that message deserves to be shouted from the rooftops.
Hmm.
Now, before we wrap up, I always like to leave our listeners with something to chew on, a thought to spark further exploration. This study focused on the EU, but what about the rest of the world?
That's a fantastic question. Healthcare systems are like fingerprints, each one unique. What are the challenges and priorities in your corner of the world?
Right. Is your healthcare system ahead of the curve, lagging behind, or somewhere in between? And more importantly, what can you as an individual do to nudge things in the right direction? Because one thing's for sure, the future of healthcare is intertwined with the smart use of technology and making sure our healthcare heroes are trained and empowered to lead that charge. Well, that's a responsibility we all share.
Couldn't have said it better myself. This conversation is just the beginning.
So to our amazing listeners, thanks for joining us on this deep dive into the exciting world of healthcare technology. Keep those questions coming, keep those conversations going, and let's build a future where technology helps us create a healthier, brighter tomorrow for everyone.